So, let me introduce you to Bloom's taxonomy. This is a classification of learning stages that is acquired based on prior knowledge. So, when you take your test or you're getting your test questions about certain things, you should be tested at the application level and above, applying and analyzing, evaluation and above. Many of you are being tested at the remembering and understanding level, which is why you're having difficulty when it comes to critical thinking. Because remembering just simply means you can recall facts, definitions, data, numbers, things like that. Doesn't mean you actually know anything. You memorize them. Understanding means you comprehend, but can you apply it? That's where critical thinking comes in. It's the application process. So remembering and understanding, that's what you need to do fundamentally. You need to already understand and remember so that you can take that information and apply it to critically think. That is why people are having difficulty. So in my next video, I'm going to show a question from Quizlet to show you that the different complexities of questions and how they're asked so that you will know whether this is a knowledge question or what we used to call knowledge is now considered to be remembering, comprehension question, which we now consider to be understanding, or application or applying and above. Your test should be applying and above. Your test. Now, if you have a quiz and they just want to say, hey, what is COPD? And you say COPD is, that's just simply remembering. Now, if you simply say, okay, what is the process of COPD and what happens to the body? That is understanding, comprehension. Now, if you give you a scenario with that basic knowledge of what it is and what happens to the body pathophysiology wise, then you can apply it. That's critical thinking. So when you can take a scenario and apply it, that's critical thinking. And then you build from there. The higher you are on Bloom's taxonomy, the better you are able to critically think. So many people are at the very bottom with remembering understanding, meaning they can just regurgitate facts. Someone who can really analyze, evaluate, and create new ideas based off of said information, you are the epitome of someone who can critically think. That's who we want in nursing, people who can critically think, not just regurgitating facts. Again, you can teach a dog to do tricks. You can teach a dog to do steps. You can teach a dog to do tasks. But with those tasks, with the understanding of what that disease process happens to be, in addition to what the pathophysiology is, and now we have a patient who presents that way, how am I going to take care of my patient? That's critical thinking.